Hi, I'm Antonio Mora. What are we thinking? That's the only thought that came to mind when I read an Associated Press survey that found only 49% of American adults say they plan to get vaccinated against COVID-19 if and when a vaccine becomes available. 20% said no way. 31% said they're not sure. Do these folks not realize that a quarter of all U.S. workers have filed jobless claims because of the shutdown triggered by the virus? That more than 100,000 people have died in 3 months? Or that a vaccine is our best chance for the country to fully get back to normal? The good news is that we are seeing encouraging signs that one or more vaccines under development will be successful. Some have even begun phase 2 human trials, raising the possibility of a best-case scenario where mass distribution could begin early next year, maybe even before the end of this year. The bad news is the anti-vaccine movement has wasted no time and has already started rallying against a possible COVID-19 vaccine. And anti-vaxxers have been remarkably successful in spreading their message now and in the past. Some studies have shown that as few as 60% of Americans are now confident in the American system to evaluate the safety of vaccines. 85% were confident in 2008. It's fine to be intelligently skeptical and to have some concern over the current expedited vaccine process. But this blanket fear and lack of confidence has led to some really crazy reactions. According to a Yahoo News YouGov survey, 28% of Americans believe Bill Gates is plotting to use a COVID-19 vaccination campaign to implant chips in billions of people to monitor their movements. Are you people serious? Do you really think Bill Gates is Lex Luthor? I love DC Comics and Marvel movies as much as the next guy, but you might want to remember they're superhero comic books. No wonder so many people believe the lies of Plandemic, a pseudo-documentary that spins a crazy tale of how the coronavirus pandemic is a massive international conspiracy. We already have seen a measles resurgence because of anti-vaxxer efforts. Combine that with people not getting vaccinated because they're afraid to go to the doctor because they think they might catch COVID-19, and we're facing a double whammy that could revive measles and other ancient, mostly eradicated diseases. Vaccinations have plunged worldwide. In the U.S., the CDC found an almost 50% drop in kids being vaccinated for measles in the first quarter. That's mostly before the worst of this pandemic. By last month, UNICEF said at least 25 countries had suspended mass measles immunizations. We know what can happen. The 2014 Ebola outbreak in West Africa disrupted vaccinations there, leading to an estimated 200,000 measles cases. Twice as many children died from the measles than from Ebola. And we're seeing it now. Polio was on the verge of global eradication, thanks in parts to Bill Gates' efforts. Now, clusters are growing. Deadly diphtheria has surged in failed states like Venezuela and Yemen. The bottom line is that vaccines represent one of the greatest achievements of science and medicine in the battle against disease. In fact, the World Health Organization says only access to clean water has been more helpful in reducing the burden of infectious diseases. Only a couple of generations ago, we lived in fear of paralysis from polio, death from smallpox, infertility from mumps, horrible birth defects from rubella, and misery, even death from measles. Those are just a few of the diseases that have seen dramatic declines because of vaccinations, which even help economic growth everywhere because of lower morbidity and mortality. Vaccines have been a major factor in doubling global life expectancy since 1900. Back then, the world average was 31. It's now more than 72. It's time for governments, health organizations, and educational institutions to take action and spread the truth about vaccines. Tough laws mandating them need to be passed and enforced, but using soft power could be even more effective in counteracting anti-vaccine propaganda. Get the most popular celebrities, Tom Hanks, Will Smith, Taylor Swift, Ariana Grande, Selena Gomez, and LeBron James among them, to appeal to their many fans and help them understand how vaccines have changed the world, how they represent hope, and how they've allowed our modern way of life free of fear from so many diseases. That would be a great public service.